welcome to this webinar. I am Federica, and I'm speaking on behalf of the Young Professional Working Group of the World Federation of Public Health Association. And it's a pleasure for me to open this session on youth leadership for peace and accountability, reimagining global health governance in Africa, as part of this year's Global Public Health Week. This year's theme, Peace for Health and Health for Peace, is particularly timely. It reminds us that health is not only a technical issue, it's deeply political and social. Health systems can either reinforce inequality and instability, or they can become powerful instruments for equity, trust, and social cohesion. And this is where governance becomes critical, because peace is not built only through the absence of conflict. It is built through fair system, inclusive decision-making, and accountability. And at the same time, health cannot be achieved without peace, because fragile context, lack of trust in institutions, and exclusion from decision-making all undermine health outcomes. And so the question becomes, how do we build governance systems that are both equitable and peace-promoting? And more importantly, also, who get to shape those systems? And this is where youth leadership matters, not just a symbolic gesture, but as a structural necessity. And we know that youth are at the forefront of responding to health challenges, whether through community engagement, innovation, advocacy, or service delivery. And yet, despite this, young professionals remain systematically underrepresented in the space where decisions are made, where policies are defined, priorities are set, and resources are allocated. So if we are serious about building accountable and peaceful health system, this must change. Because excluding youth does not just limit representation, it limits the relevance, the legitimacy, and effectiveness of governance itself. And at the time when we are facing complex and interconnected challenges, climate change, emerging health threat, antimicrobial resistance, persistent inequities, we need governance systems that are not only technically sound, but also inclusive, transparent, and forward-looking. So today, I'm really happy to have this webinar co-organized with the Young World Federation, the Africa CDC Youth Division, the International Working Group of Health System Strengthening, and the Global Health Next Generation Network. And we are not just contributed, but we are actors shaping governance. So I don't want to take too much time from this webinar. I really thank you all for joining us, and I am gonna now pass the voice to Bettina from the International Working Group of Health System Strengthening. And thank you so much for joining.
Hello, everyone. Thank you so much, Federica, for that fantastic introduction to this vital and very, very important session. I'm just going to put on my mic and my video and just say hi. I'm still at work, so I'm going to put my video off as I do this introductory session to everybody. But welcome to everyone. I think this is such an important week where we recognize, public health and the role public health is playing in peace and security, and such a timely topic, given what's happening in our world, the increase of conflict that's going on in our world. But more than that, we also understand that peace isn't just the absence of conflict. It is about individuals living in societies where their fullest potential can be met. That means living in societies that are peaceful in themselves, that offer opportunities, economic opportunities. All of those are elements of peace and are important for the thriving of an individual, especially for a young person. So even though the session is about peace, I think we need to think about peace in its broadest sense and its broadest applicability. And that's why the Africa CDC Youth Engagement Strategy, which aims to empower young people, it aims to bring young people to the forefront of youth inclusion, to ensure that they really do grow up in environments that foster their potential and really help them meet their best person, is so applicable to this overall conversation that we are having about peace and sustainability in the world and in Africa. And to introduce that policy to you, we're going to be having a keynote address from none other than Dr. Chris Promise Kaniki. Dr. Kaniki is a phenomenal individual who has been spearheading and leading youth engagement across the African continent when it comes to public health and health spaces. I think so many of us are a testament of his dedication, of his work, and we're just so grateful to him for joining us. Dr. Kaniki is a senior director at the Africa CDC, where he is the head of the strategic partnerships at the Africa CDC, as well as the head of the Africa CDC Youth Division, also a PhD candidate at the University of Ibadan, where his PhD focuses on reproductive health sciences. Dr. K, we are so privileged to have you in the space, so grateful to you for your time to come and speak to us and lead our keynote address today. So over to you, Dr. Kaniki, to introduce the Africa CDC Youth Engagement Strategy and the session for today.
Thank you, Frederica. Thank you, Bettina, for the introduction. And I think I don't have much to add to what the two of you have said already as you introduced them, but let me just go directly to my slide. I mean, my keynote, I just wanted to share this as a slide. I don't know how many minutes do I have, so that I don't take much of the time as you had the panel discussion.
Around 10 minutes, Dr. Kaniki, around 10 minutes.
Excellent. That's fine. That will work. So once again, thank you for having me on this session today. Greetings and welcome to everyone who have joined the call. It's a pleasure being here. And as Bettina just said, it's our mandate, but also a pleasure to share with young people, continue supporting African youth when it comes to public health on the continent, because as we said at Africa CDC, there's nothing that we can do on the continent when it comes to public health without engaging young people. And we need to see this as young people as participants, but not beneficiary of our initiative on the continent. Because if we change that way of seeing young people as beneficiaries or participants, it's really gonna help us in what we are trying to achieve. So I've been asked to share some, thought on this strategy that Africa CDC we've launched last year when it comes to young people. And as you can see, the aim of this strategy is to make sure that we're engaging young people as co-architects of Africa's self-security, not only as beneficiaries. The background of this strategy is as to say that knowing how the continent is made, almost 65 to 70% of our population is made of young people on the continent. And this is why I was saying that we can't achieve anything on the continent if you are not engaging young people, because these young people are not just numbers, they are health professional, they are health advocates, but also have a great potential when it comes to innovate and advance Africa's health agenda, and even the role in our countries in promoting public health and reaching communities. So we need to support and consider young people as partner and this asset that we need for us to be able to implement or achieve our agendas. The role of young people as professionals, as we used to say, just briefly, the why we need to look at this. We know that when it's come to drive innovation today and engage digital engagement, we can count on young people improving health outcome through youth-led project, community engagement, but also when it's come to cultivate issues around inclusivity, trust, and local champion for sustainable health system. As of now, and as I mentioned, we know in terms of demography, young people are making the larger population of our continent, and they're playing a key role. Remember, like for example, during COVID, we have young people stepping out to mobilize communities. We know when it's come to issues like sexual and productive health, how young people are engaged in terms of mobilization. And they are also contributing when it comes to innovation. Now that you're talking about digital health, young people are majority coming into support and bringing some innovative ideas that are contributing to advance digital health agenda on the continent. And in terms of community reach, it's young people again who are doing the great job in this. So in terms of a contribution, we know that young people are leading when it comes to advocacy, they are leading youth community engagement, but also pioneering research and innovation. So this is why at Africa CDC, we came up with the idea of developing this strategy that is now going to guide or formalize the engagement of young people at continental level. And they say not only as beneficiaries, but you want to make sure that young people are contributing and as partner to our initiative on the continent. As a continent, as Africa CDC, we've developed since, 2023, we have a strategic plan. We had the new public health order, but actually we're talking about the Africa Health Security and Sovereignty agenda. We have at the Africa Union, the Africa Youth Charter, which is also under revision. This year, we are going to have the new one and the Agenda 2063, which is the main continental agenda. But with all these documents, we thought that we need a strategy that is going to help or guide the youth engagement in contributing for the implementation and the success of all these agenda. So for us, the Africa CDC strategy is not like an additional document to all these you're saying, as I said, the strategic plan, the community workforce strategy, the Agenda 2063, but it's a tool that is helping us to engage and implement these agendas. It's equally important to remind that to include and meaningfully engage young people, there's a reason, as I said, the power that young people have when it comes to have inclusive, this including young people, it can also help in terms of integrating young people in the process for inclusive policy, innovation as well. When they're leading, when it comes to tech, young people are likely to leverage digital skill for health innovation. I've said it already, when it comes to grassroots impact, community engagement, young people are well placed. And for policy influence, we need also on this specifically to keep engaging young people in policy making to ensure the relevance and effectiveness, efficiency of these policies. So why this strategy? This strategy aims, it has been designed to mobilize, empower, and engage young people when it comes to shaping our continental public health landscape. And in this, we keep recognizing them as leaders and key partners, aiming at creating an enabling environment coming to policy, program, and project for young people to demonstrate their leadership in public health on the continent. It has 5 strategic objectives. The first one is about creating architecture for young people on the continent. And we know that, as I say, we used to have this engagement with young people based on some issues like sexual productive health. But what we need now to do is to create this kind of environment where it's more globally, not just based on one topic, but some framework, where we can be able to coordinate and mainstream young people engagement within Africa CDC, but also on the continent. And here we're looking at implementing this strategy broadly on the continent by supporting member states as well. Accessible and inclusive spaces here is to facilitate these spaces for active and meaningful youth engagement and collaboration as well, where young people, they can convene, as we are doing now, virtually or in person, to share and exchange knowledge and cross-fertilize when it comes to new idea, but also integrating African youth voices and knowledge into the continental global spaces and policy processes, but as we can also think of establishing some kind of platform and communication channel where young people are accessing the knowledge and resources. The third one, in terms of youth-led and directed partnership, here we look at empowering and promote youth-oriented partnership in public health initiative by providing resources and collaboration with diverse and multi-sectoral stakeholder. And here we want to work with institutions like universities or youth-led organization to support youth-led network across the continent and engaging them when it's come to encouraging in terms of a kind of a multi-sectoral collaboration. Workforce development, here again, we want to develop some programs that are going to extend the quality and the quantity of public health professionals on the continent. We know that we have this gap when it's come to the public health workforce on the continent, and we need to make sure that we are supporting as well, bringing young people in terms of recruitment, training, but also mentorship and any kind of fellowship on the continent. And lastly is the one, I mean, this is a very important one in terms of developing and supporting sustainable continental and regional funding mechanisms to facilitate young people to implement youth-led program on the continent. So taken together, these are the objectives that are supporting the vision behind the Africa CDC strategy for, engagement for young people. And this is also a study that has been developed and even refined with the contribution not only from the Africa CDC youth program, but young people on the continent, those who attended the YPC 2023, but also some experts who supported us in this process. These are just the guiding principle. I wanted to share a slide in terms of how we developed the strategy based on this principle, making sure that we keep the youth engagement as a core principle that is guiding us. Youth leadership, multi-sectoral approach, as I mentioned, collaboration with interdisciplinary and collaboration for community reach, but also with partners. The innovation, we know young people are tech savvy, gender balance, inclusion, and regional spread, where we want to make sure that across the continent we are supporting young people. And as of now, the strategy, as I say, for us, is not just a strategy, but it's a tool that is helping us to implement all the strategy that we have on the continent. And so far, on the 7 flagship initiative in the strategy, 4 of them have been implemented already or running. We have the Youth in Digital Health Network, that is a platform amplifying youth voices and when it's come to digital health, innovation, and creativity of young people in that space. And here we work with, for those who know, like the Africa Health Tech Summit that used to happen in October, but this year we are having as 2 editions, one in June and a second one in October. Bingo Plus, that is an initiative that was birthed from the main one, the Bingo initiative we had in 2022. But this one serves as an incubator where we have to bring young people and provide some small grant for them to implement their initiative at community level. The youth voices and webinars such as this one that you're organizing here, we also bring young people and experts to exchange and encourage young people in what they are doing. The youth advisory team for health, one of the team that has been established as well, representing the continent, 5 young people who are serving as advisors at a youth program, but also the Director General in terms of engaging young people. The rest, very soon, we are going to bring this other initiative to life, especially the youth, a young professional program that is going to engage a number of young people. For those who may have get the information. Like last year when the DG of Africa CDC in Durban wanted us to implement this initiative and bring at least 100 young people joining Africa CDC to work with us. So when it comes to role and responsibility, we also wanted to make sure that this strategy has everyone contributing. We need to make sure that everyone knows what is or their role and work toward us so that the strategy can be successful. As Africa CDC, the role is mainly to oversight the oversight of the initiative, spearheading its planning, monitoring, reporting, facilitating forum like the one we used to have on the marginal CPHI or Africa FTech Summit, transparency and accountability, advocacy, but also promoting the domestication, which we have started, for example, in Nigeria, where the minister is engaging, play to domesticate the strategy. And actually, we are also doing an assessment on the continent with all the 55 member states to understand what is the situation right now in the continent and how this strategy is going to be implemented in the country. So, and here, this is where maybe on the next slide, where we are now also calling young people to be active in terms of amplifying and implementing the strategy, working together with the main ministry we are working with in the country is the Ministry of Health and the Ministry of Youth. We're brought together. We're supporting them in terms of implementing this strategy at country level or embedding it into the framework that exists already at country level. Productivity, we expect young people to demonstrate that value as well, engaging with their peer, championing the mobilization and resource for this strategy, promoting collaboration, but also keep advocating those efforts to encourage each of us, their member state, to adopt and integrate the action plan within this strategy at country level. The youth advisory team for health, their role is also to continue representing the youth of the continent as doing advocating for the full implementation of the strategy and all the initiative, support Africa CDC with all the initiative that we are coming up with, even bringing more idea on how we can continue engaging young people, the transparent and responsive approach to meeting our objective, but also an active engagement in M&A of our strategy. At African Union level, we are also working with our colleague at the Commission to make sure that they're also playing a pivotal role in implementing the strategy, integrating it in their own initiative like the AU, the volunteer initiative that has been launched for another cohort. And I'm inviting for those who want to apply for that initiative as well, please do so and continue supporting our continent. And we are looking at working with regional blocs like REX, AU NEPAD, AU IBAD to continue implementing this at regional level. And as I mentioned, with member states, we are trying to align with what they have at national level in the context of engaging young people, recognizing and continue engaging young people when it comes to their contribution and valuing them and their expertise as well in shaping effective health intervention. More importantly, we need to align with the national youth policies, and this is where I mentioned that we are working together with the two ministries to make sure that within the framework that they have at country level, we can support them to align with the strategy. But beyond that, we also need to work with funding because nothing can happen if we don't have funding. And this is where we also recognize the support that we had so far with a lot of our partner coming in to support and funds this initiative at Africa CDC level, but continental level as well, especially GIZ, MasterCard, and many others who have been helping us in terms of technical assistance, training young people, but also we keep identifying the gaps in terms of implementation of this strategy to support the solution to issue that as it's needed. So before I end my presentation, this is our call to action, where as Africa CDC, we are calling on each other, partners, member states, and the youth especially, to join us as we work together toward an Africa where young people are engaged as equal, and I say equal partner and co-architecture in building a safer, healthier, and prosperous continent for everyone. I thank you.
Thank you. Thank you so much, Dr. Kaniki, for this amazing presentation. And I think it's a really good start to start our panel discussion. And I think it was very interesting, as you said, this is not just a strategy, it's a tool for actually implement everything that you presented. So thank you so much. And for everyone who is attending the webinar, if you have any question to Dr. Kaniki, there is the Q&A part, so you can just write your question there, and when we will have the Q&A for the panel, we are also going to try to integrate the question to Dr. Kaniki. Feel free to just use that. So I'm now going to give the word to Romina, representing the Global Health Next Generation Network. Thank you.
Thank you, Federica. And hello, everyone. My name is Romina Rios. I'm a medical doctor and researcher in infectious diseases from Peru. I have a master's in global health and now also the representative of the Global Health Next Generation Network, as Federica already kindly mentioned. It's a pleasure to moderate this panel discussion. Today, we'll be exploring two key themes: understanding how global health governance works in practice, and the role that youth can play in strengthening accountability and promoting peace through more inclusive systems. As we've heard, while young people are actively contributing to health systems, their participation in decision-making spaces remains limited. And this panel brings together diverse perspectives from organizations working to change that. As Federica also mentioned before, we are welcoming questions from the audience, so please feel free to share them in the Zoom chat at any time. Today, I'm delighted to be joined by our panelists today. First, we have Karen Monpicho. Karen is an emergency response officer at the Zambia National Public Health Institute, supporting emergency preparedness. She has led multi-sector collaborations involving government, UN agencies, NGOs, and communities. And she holds a bachelor's in occupational health and safety and is pursuing a master's in disaster studies with a focus on resilient health systems in Africa. We also have Juliette Ubedejo-Shaibu. Juliette is a public health professional, researcher, and PMP certified project manager with expertise in environmental health, climate justice, and policy advocacy. She holds an MPH and is pursuing a PhD and serves on global health advisory groups, including the International Working Group for Health Systems Strengthening. Her work focuses on translating research into policy and advancing equitable, resilient health systems. We also have Olivier Nihimbaswe. Olivier is the Youth Engagement and Program Support Officer at Africa CDC, advancing youth participation in global health policy and governance. He's also the founder of Water for Deaf, an award-winning social enterprise delivering climate-smart water solutions to over 240,000 people in Burundi. His work has been recognized by initiatives including DPRIZE, UNDP, MasterCard Foundation, and One Young World. And last but not least, we have Hafiz Hamza. He's a global health professional specializing in antimicrobial resistance, One Health, and environmental health governance. With over 5 years of experience in policy and youth engagement, he's a member of the quadripartite working group on youth engagement for AMR and a board member of the Young WFPHA. His work combines advocacy and research with over 10 publications focused on youth engagement and health systems in Africa. I want to welcome all of our panelists, and to start us off, I'd like to invite Karen to reflect on one question. In the context of peace for health and health for peace, how can youth leaders actively contribute to building accountable health systems that also promote social cohesion and peace, particularly in African context? Karen, please go ahead.
Thank you so much, Romina, for that wonderful question. And I'm so glad and privileged to be part of this panel where we discuss key issues pertaining to health. And thank you all to everyone that is joining. So I think my perspective is that as youths, we have a role to play in these emergency preparedness and response settings. You agree with me that in an area of crisis, there's a lot of mistrust between the communities and the government, and hence we need youth to act as advocates, to bridge the gap between the communities as well as the government mistrust. And aside from that, maybe I'll just share one experience that happened in my country when we were responding, I think, to cholera at the time. So we were deployed in a district and we started doing our response activities there, but then the communities were resistant to the activities that we're doing in the communities. They were actually telling us that we are the ones that are bringing the disease into their communities. So also that highlighted just the importance of putting a youth out there who can advocate for change and influence their communities. I hope I answered the question.
Yes, thank you, Karen, and that's such an interesting experience as well. Thank you for sharing that. I want to go ahead and go with Juliet. Juliet, in your experience, where exactly do youth influence decisions and where are they excluded?
Thank you very much, Karen, for that question. Good afternoon, everyone. I'm going to quickly turn on my camera so you see my face before I turn it off again. So can you see my face?
Yes.
Okay, so this is Juliet speaking, but I'm going to quickly turn off the camera. Sorry, I have kids around, so thank you. Yeah, so in response to your questions, I would say that when we try to examine youth currently and how they influence decisions, it's very important to acknowledge that young people today are increasingly active and they're very visible across different sectors of global health and governance. And their influence is most evident in spaces that has to do with mobilization, advocacy, awareness campaigns, peer education, digital communication, youth-led researches, and innovative initiatives, especially with the introduction of technologies. And then we also have youth networks, civil society organizations, professional platforms where we have youths that help to drive critical issues around great health issues such as public health and pandemic preparedness. But in most cases, they have youths are introduced or they're invited into implementation spaces. For example, when they have like stakeholders meetings or some technical workshop, we have youths that are invited to provide their insights and then to help to design intervention. However, where the challenge for youth participation lies is youths are invited to these conversations when decisions are actually made. So they basically don't have the real authority over this policy formulation. They're basically just listening to policies that have already been made, which means their input may be little or none at that point. And these are spaces where priorities are set, where resources are distributed, where long-term strategies are determined. But in most cases, youth are often not present in these rooms. Another major issue that has to do with inclusion of youth is they are sometimes brought in the process too late, where other priorities have been set and then the agenda have already been set. So rather than the youth helping to direct the decisions, they are simply asked to react to decisions which are already in motion. Of course, this is very, very difficult. And in most cases, this limits the engagement of the youth. So instead of the youth to participate in the consultation process and the incorporation process, they rather just stay there and then just listen to these decisions that have been made. So we must actually recognize that in some institutions, youth inclusion remains largely tokenistic. By that, I mean they are given the seats, but not the voice, where they are just included because they have to be included as stakeholders, but not necessarily because we want to actually take cognizance of what their own voice or their view would be. So beyond this, there are also structural barriers that influences the involvement of youth. By that I mean, in many settings where we still have age is still wrongly associated with competence and experience. I will use myself as an example where when I started looking for a job, there are some jobs I knew I could actually do, but then because I was so young, it was believed that I didn't have the experience and competence to provide my expertise for that role. So many youths are still faced with that, even though they are highly qualified and technically capable. So this creates unnecessary gatekeeping and reinforces exclusion from taking senior decision processes. So in summary, I would say youth today influence implementation, advocacy, consultation, but they remain largely excluded from governance, from financing, and from strategic leadership. If we truly want meaningful youth engagement, then institutions must move beyond just inviting youth to participate and begin embedding youth into systems. And must move beyond just inviting youth, but they have to embed youth into systems and then power and decision-making processes. But ultimately, the real question will be, is not whether youth are in the room, it's whether they have the power to shape what is in that room. Thank you very much.
Thank you so much, Juliet. That was so interesting. And thank you for mentioning about the tokenistic inclusion of youth. I would like to go ahead and go with Olivia. Olivia, hello. I wanted to ask you about the Africa CDC Youth Engagement Strategy. I think it's a major step forward. What do you think what are the concrete mechanisms within this framework that ensure that youth voices are not only heard, but actually shape policy and accountability process following what Julia just mentioned?
All right, thank you so much, and thank you for the introduction, and hi to everyone, and thanks for joining this session. I think number one, there are mechanisms, of course, so many mechanisms that are in the youth strategy of Africa CDC, but I may not mention all of them because some of the mechanisms already have been presented by Dr. Kaniki. But I just wish to mention that at Africa CDC, we have mechanisms to institutionalize youth engagement. Number one, we have the youth division, which is within the executive office, and it's there to champion meaningful youth engagement and participation. But also, we have what we call the Youth Advisory Team for Health, which is not an ad hoc body, but something embedded within Africa CDC architecture. And this has the mandate to advise the leadership of Africa CDC and also contribute to formulating policies and also participate in the implementation. So one of the key achievements of the inaugural advisory team at Africa CDC has been the development actually of this strategy. And this year, we shall select a new advisory team. This is something which we continue. And so this means that the policies are not, the young people are not bringing inputs after the policies are made, but rather before. They are the one co-creating the policies, but also during the implementation and the review processes. Number two, we have the Youth Pre-Conference. And this is an event which takes place every year at the margins of the International Conference on Public Health in Africa, which is one of the major events on public health in Africa. And it usually brings together hundreds of young people. And they are there to not only to be consulted, but also to co-create the policies, and the outcomes are usually fed into the decisions from the CPHI, the World Health Assembly, but even at the UN General Assembly. So The other mechanism is, of course, to ensure that the young people are not only involved, engaged during the policy formulation, but also during the implementation. And through different programs that have been implemented by Africa CDC, the Bingwa Plus, AU Bingwa Initiative, YDHN, and innovation challenges to provide funding for young people. There's also what Dr. Kaniki talked about, the young professional program in the YPP, which we are looking forward to starting, whereby we want to make sure that we have more young people in the system. There's something Juliet mentioned, which is very important. We need more young people in the system, in these spaces where the decisions are made, where we can be able to push for the youth agenda. And we need more people like Dr. Kaniki. You know, sometimes we need, we can advocate as young people, but at some time we also need to realize that we need young people into the system. We need young people into organizations like Africa CDC. We need young people into ministries of health, of youth, in the government, so that they can really push for the interests of the young people. But also the other thing I want to mention, which already Dr. Kaniki said, is that we are not looking at this strategy as a tool for only Africa CDC, but for the member states of the African Union. You know, Africa CDC is an entity of the African Union. So we are pushing to make sure that this tool, this strategy is domesticated in countries, and make sure that the ministries of health, ministries of youth have the tools. They are able to align with the interests of young people. And I think Africa CDC is in the right position to push for this as a continental organization. Thank you so much.
Thank you so much, Olivier. And I think it complements really well with the previous presentation of Dr. Kaniki. I would like to go ahead now with Hafiz. Hello. Hafiz, I would like to ask you about global health security decisions. We know they are often made in high-level closed spaces, and how can governance in this area become more transparent and inclusive, particularly for young professionals from the global south?
Thank you so much, Romina. First of all, I appreciate the invitation. I'm glad to be here today, this afternoon. And thank you to our participants as well for joining us. Looking forward to the insightful discussions. I just quickly wanted to also appreciate the previous speakers who came before me, starting from Dr. Kaniki, who presented very nicely about the youth engagement strategy, which is much, much needed in the context of the African region. I also want to appreciate the example, Karen, that you gave when you were talking about, contribution to accountability. That was insightful. I love the comment from Juliet as well when she mentioned that youth are given the seat but not the voice. And of course, I want to also appreciate what Olivier was mentioning there regarding some of the strategies within Africa CDC, including the youth division, the pre-youth assembly at CPHIA, and moving to youth involvement or engagement, not only at a policy level, but implementation. Now, the reason why I'm highlighting these points is tied to the question itself. You can see from the examples and the framework that is being presented, from the examples that Karen gave, from the comment of Juliet, where youth are given the seat but not the voice, and the need for strategies, as was pointed out by Olivier, that the current architecture as a whole of the global health security, global health governance in itself was not designed to be youth-centric. This is what you can take from all of these statements and examples and experiences. And so we need to revamp the system so that it is focused for the young people as well. It is inclusive for them. It is transparent for them. It is accountable to them. And we keep on mentioning this stat, but it is really, the systems are designed to serve the masses. And in the context of Africa, the population is 65 to 70% of the African population comprises of young people. And therefore, if your systems, they are not designed to be youth-centric, youth-focused, then ultimately, which masses are you serving? So Now, the question that you asked, Romina, to me is very interesting. And I think we can honestly dive into deeper conversations beyond this webinar, maybe even and maybe beyond a few days, because what you asked is a revamp of the whole architecture in itself. But what I would like to do is to summarize my answer into three key things, which I think are important or very essential from the get-go. Among them, the first thing is to have structured access and not symbolic seats. As linking honestly the example from Karen, but also the point that Juliet was mentioning, is that, you know, beyond the symbolic seat, we need structured access. And when we talk about structured access, what do we mean? We have high-level decision-making bodies for the African Union, at the World Health Assembly, for the WHO, for the United Nations Environment Assembly, for UNEP, and many more institutions, but also at a national level. You know, we need to see young people being involved into those drafts of policy texts that are being circulated. They need to be given chances to have an input into those texts. They need to be given access and opportunity to be represented in those discussions, but not just being represented, as was mentioned, by just being given a seat, but actually being given slots to speak, to meaningfully contribute. And that is where the structured access comes in, so that the way we have presented the youth engagement strategy today on a slide, we can actually project it and say, this is what structured, meaningful youth engagement looks like, where everybody's able to understand that this is how youth are shaping the agenda. And so this is so important, that structural integration, that structured access. And of course, that follows into my second point, which is so important as well, is that nothing can happen without finances. You know, young people are not able to afford the resources that are needed to be involved in the policy conversations. Most of the work that is being taken place, if you do an analysis actually, is that the young people are so passionate about what they do, is most often than not, they're financing themselves. You know, they're using their own funds to be able to be in those policy conversations, whether it's transport, whether it's accommodation, whether it's the other expenses that are associated with that, and so on and so forth. But also at the same time, remember that they're still juggling their life, whether it's through university, through being an early career professional, and taking out the time to be contributing to this. And therefore, they need that financing mechanism. You know, the architecture, the way it's designed, it needs to be able to support them. You cannot say that you are pro-youth, you are meaningfully engaging youth, when you do not have resources to actually make sure that they are meaningfully contributing to the space. And none more so than financing the population that is the most or represents the highest number in the African context. And I think the last thing that I would mention is that, you know, because the question touched about inclusivity, but also touched about accountability. And I think this is very important, because to do accountability, you need to sit down and say, before the start of the program or before the start of our policy implementation engagement, we had set a couple of indicators that we wanted to put forward. Now, this is where the accountability comes in. First and foremost, we need to make sure that these indicators themselves that we are saying are going to be accountable, they need to be youth-focused. They need to be youth-friendly. They need to be things that are meant for the young people, you know, specifically. Because when we set those indicators, then we are intentional about achieving them. And so that is the first step in terms of making sure we are accountable to ourselves on youth engagement. But then the process in itself of accountability, you know, we say that we want to do monitoring and evaluation, M&E plans. We want to do, you know, sit down and have discussions on what is happening across the region. It's important that in that monitoring and evaluation meeting, in those conversations, we also have youth representation to say, yes, indeed, the indicators that you have set, they match our needs, and they are aligning with the goals that were set. I think the other things that I want to mention is that these processes, they need to be done with the young people for sure, but also we need to allow channels for continuous feedback. We don't have to wait for the monitoring and evaluation meeting just to say that, you know what, it was working or it was not working. What we need to have as well is to have a structured way of collecting feedback so that when it's not working immediately, we're able to provide feedback, it's picked up, and then it's rectified, rather than waiting for 3 years. And then we say, now let us do a monitoring and evaluation, and we've lost 3 years of our time. Thank you so much.
Thank you, Hafiz. I think you've pointed out and you've given a really good closure. Just before we close, I would like to invite each of you to share one final word on what peace, health, and youth in governance mean to you. Just one final word. I'll start with Karen. Karen, please.
All right, thank you so much. So for me, I think it's about being involved in the decisions that are made and how those decisions are going to be implemented, because, peace is one area that we cannot run away from, so we need youths that can translate those policies into action, because where we just have policies that do not have action oriented, it's as good as having a storybook. So we need youths that can take action, talk about these policies, influence a larger audience. And with the coming of social media nowadays, youths are really doing an incredible job, and just being out there and talking about issues that needs action and change. So for me, I think it's very key, that youths are not just limited to followership roles, but can actually be built, with leadership skills that enable them to take accountability, as well as know when and how to make decisions. Without taking much of your time, I think for me, I would close with that. Thank you.
Thank you, Karen. Thank you so much. I'll go with Juliet now. In the best interest of time, I'll emphasize on one final word on what peace, health, and youth in governance mean to you, Juliet.
Thank you very much, Karen, for that question. To me, peace in this context and governance means youth involvement, where we create an environment for youth to feel heard, to feel valued, to feel seen, to feel empowered to make a meaningful contribution to the society and decision-making processes. Like I said earlier, it's not just about giving them a seat, but also giving them a voice. Thank you very much.
Thank you, Juliet. And Olivier, please, one word.
All right. Thank you so much. For me, I think peace, health, and youth are three concepts which are deeply connected. And peace creates a space whereby communities can thrive and develop, but also health gives the people the strength and the dignity to participate fully in the society. But when it comes to young people, we bring energy, we bring ideas and innovations that transform our communities for a lasting change. Thank you.
Thank you, Olivier. And Hafiz, please.
Thank you so much, Romina. I will just be very brief. It means access to healthcare services, especially for those who need it the most. Thank you so much.
Thank you so much. And before we close, Dr. Kaniki has his hand up. Please go ahead.
Thank you for allowing me to come in just maybe 2 seconds. Very interesting point that have been raised. Hafiz, Juliet, Karen, and Olivier. And these are the things that we also need to listen to in when implementing this kind of strategy. And thank you so much for those points. It's very important. I would like to highlight this, Karen. Your point is very valid. I really that it's not just giving a seat, but the voice. We need to make sure that we're giving people the voice. And the 3 point by Hafiz as well. Thank you so much for that. I mean, Juliet, who mentioned that point. Thank you so much. But I would like to end in this. At Africa CDC, we say we need to give young people the opportunity to learn, lead, and impact. Learning from what you are doing for them to be able to be the leaders in what you are doing and create the impact you want to see. I thank you.
Thank you, Dr. Kaniki. Thank you so much, everyone, and all the panelists for your incredible, interesting insights. We will continue these conversations and collective efforts on the 18th World Congress on Public Health, taking place from September 6 to 9 in Cape Town in South Africa. Thank you for all the engagement. Please, we're moving ahead with Federica. Thank you.
Thank you. Thank you so much, Romina, for facilitating this amazing panel. I think everyone really centered the point of why we decided to have this webinar and this webinar during the Global Public Health Week. And I also want really to thank Dr. Kaniki for the motivation ending. I really think that we need to hear more and more. And I think that in this African and Africa CDC and the EU strategy, and it's actually an example for all the other continents. So I'm really happy to hear it, and thank you. And before closing, just really, as Romina said, I want just to summarize a little bit. And we saw that in this discussion, and Dr. Kaniki also mentioned, youth are present and we need youth in decision-making spaces. But also we discussed and we touched a little bit on the importance of accountability and inclusion for both health and peace. Governance system that are transparent and participatory, build trust, and trust is essential for effective health system and for social cohesion. And today, I think that all the panelists and all the examples that they actually made shown that youth are not waiting to be included. They are already leading. We are already leading, and this is actually amazing. And through network like today, through partnership, innovation, and youth are actively redefining governance spaces. So as Romina said, this session is not a standalone moment. It's actually part of a broader continuum that we decided to have. And we are going to carry forward to the World Congress on Public Health in South Africa, that is led by the World Federation of Public Health Association in collaboration with the FASA, with the Public Health Association of South Africa, from the 6th to the 9th of September, where we are actually going to move forward through this dialogue. We're going to deepen this dialogue and then talk more about how to translate all of this insight into actionable recommendation. But beyond this specific event, this conversation is also part of something larger. As I was mentioning at the beginning, the Global Public Health Week each year plays a critical role in shaping global advocacy and bring together voices from across the region, sector, generation to actually reflect, challenge, and set priority for the future of public health. And before I was having a conversation with the CEO of the World Federation that said that Global Public Health Week had more than 100 events involving more than 70 countries worldwide and more than 21 languages. So I think that being part also of this initiative, it's extremely important. And this year team, Peace for Health and Health for Peace, it's a topic that was underline of all of our discussion, and we know that inclusive and accountable governance is a pathway to peace, and then peaceful, just society are essential for achieving health for all. And I just want to close with a final reflection for all of us, panel and attendees. If health is peace and peace require inclusion and accountability, then what is the role each of us will play in making governance more just, more representative, and more responsive? Because reimagining global health governance is not just happening at the global forum, but happen through the everyday decision that we influence, the space we open, and the system we challenge. So thank you so much for all your engagement. We are exactly punctual, and we'll look forward to continue this journey together through the rest of the Global Public Health Week, through the World Congress in Public Health and beyond. So thank you so much, panel. Thank you, Dr. Kaniki. Thank you, Romina, for the moderation, and thank you for attending this webinar. Thank you so much.